Now, according to the National Bureau of Statistics, over 133 million Nigerians are multidimensionally poor, while over 70% of the population use out-of-pocket modes of payment for their medical needs, and only 7% of the population have access to quality health insurance. Stakeholders converged on Tuesday at a webinar organized by the cable newspaper in commemoration of its 10th anniversary to discuss practical solutions to alleviate the dire situation and ensure equitable access to essential health care. Speaking at the webinar, the Coordinating Minister of Health and Social Welfare, Professor Ali Pate, identified forex crisis, inflation, importation of drugs, elimination of fuel subsidies, technical know-how, amongst many others, as the major factors that influence the continuous surge in the prices of medications within Nigeria.
In Nigeria, I believe, as the chairman hinted at, we're playing catch-up. I think for 20 years or more, if we had built an industrial base to manufacture APIs, to manufacture some of our critical pharmaceuticals, we probably will have a much lesser impact from the globally increasing price of APIs and all the things that have happened on supply chains. But nonetheless, we are focused on solving the issue, and we've been working hard to do so through the presidential initiative to unlock the healthcare value chain, which, as you recall, Mr. President inaugurated or announced in October 2023. There are two buckets of issues underlying what we are observing now. The Nigerians are hurting. Of course, there's a forex devaluation, which is on the supply side, the ability to buy the raw materials, to buy the equipment, the infrastructural deficit. I think while there is some infrastructure for manufacturing, I don't think it's at the level that you could say will meet up to the demand that we have. Other issues that go beyond infrastructure for manufacturing, including power, the know-how and technology itself, the supply chain, which has been fragmented, and the regulatory landscape. On the supply side, I think they contributed. But it's not only the supply side, but the demand side, the financing of healthcare in Nigeria and the affordability has been a long-standing issue for more than 40 years. Less than 10% of Nigerians have insurance or any insurance to speak of, which means most of our financing for healthcare is out of pocket.
When this issue started, we contacted pharmaceutical companies. All pharmaceutical companies contacted us. Can we import this? We gave them special permission to import. So that is part of what NAFDAC can do. We react to shortages. If a company says we have done X, Y, Z, and we confirm that there's shortage, we ask them to import and we give them faster registration process, expedited registration process. These are the types of means to reduce the impact of exit of multinationals.
Today in India, you will find that there are over 3,000 drug companies. In India, you'll find that there are over 10,500 manufacturing facilities. Today in India, you will find that their production makes them proud. They produce enough for home demand. They command over 20% of global pharma supply chain. They address more than 60% of global demand for vaccines. They meet more than 40% of the generic demands in the US. And they provide more than 25% of all the medicines used in the UK. The pharma industry in India has become a dynamic pharma power base for the economy of India. Why can't we in Nigeria do that? Seize the opportunity of the moment. The pharmaceutical industry in Nigeria is at a very infant stage. The big companies that were here, majorly foreign, are leaving